family support in long COVID. What is the family's role for our long COVID patients? Welcome, everyone. Greetings of health and wellness. How are you today? Yes, type in the chat box one word that describes how you are today. Yes, I'm Riva Galvez Tan, your host for today. And also, I'll be sharing together with my dad, Dr. Me Galvez Tan, later about how to support those who are in long COVID from the family's perspective. Yes, so I'm excited to learn from each one of you later in our chat box. If you are going to share your questions and comments, we would be glad to know more about how you are feeling about this webinar and what you are learning. Yes. So this afternoon, we have a lot of people joining us. Some may have been diagnosed with long COVID. Some may not know they have long COVID. And some family members, of course, of long COVID patients, health professionals. From the bottom of our hearts, thank you for spending this time with us. We are so glad that you're here. So this Zoom webinar is recorded. So yeah, you may share this later on with some family and friends if you like to. I would also like to remind you to utilize the Q&A box for questions. There are going to be questions later that you will be answering. I can't promise it will answer all questions because of the limited time, but we will do our best to address your questions. Lastly, we value your feedback. So later, we will share the link to our evaluation form that must be accomplished within 24 hours after the webinar. There will also be e-certificates provided to Zoom attendees who will stay from beginning to end. So throughout the program. And of course, you have to accomplish the short evaluation form that will be sent towards the end of the program. Thank you very much for being with us today. So for our welcome remarks, I'd like to call on Dr. Cora de Los Angeles Añuevo, the President of Health Futures Foundation Incorporated.
Good afternoon, webinar participants. We have an exciting topic for today: family support in long COVID, rarely discussed or tackled in the numerous COVID-19 pandemic webinar sessions and patient experiences interviews. Long COVID is typically defined as symptoms lingering for over 4, even up to 12 weeks after diagnosis. I'm sure some of us have contracted the COVID-19 virus. I did. Studies show that 10 to 20% of individuals who caught COVID-19 may experience continued symptoms after their initial infection. Such is the case of Ms. Bex Galvez Tan, the Executive Director of the HFI, with long-lasting symptoms that arise months after infection, such as difficulty concentrating, the so-called brain fog, extreme tiredness, and shortness of breath. The task of caring for long COVID patients can be overwhelming. Family members of long COVID survivors continue to worry about a loved one's health, especially because long COVID is a new condition, and understanding its symptoms and impact on individuals is evolving. We can assume that the whole family is affected, and family members of long COVID survivors may be thrust into the role of caregiver for their loved ones. Ano nga ba ang physical, psychological, emotional, and spiritual needs of a long COVID patient? Ms. Beck's husband, Doc Jimmy, and daughter, Ms. Riva, both speakers will be properly introduced in a while, will provide insights on how they cope with the impact of long COVID, including the best practices in caring for long COVID patients. Siguro pwede rin nilang i-share their challenges and how they handle the strain of keeping the household running while caring for Bex. So let's listen to their stories. The discussion will show us the importance of recognizing family-based care and believing in the family's ability to manage health crises like the long COVID. On behalf of the I warmly welcome you to this webinar. I urge you to participate during the open forum, ask questions, and give your reactions and comments. Have a beautiful day, everyone.
Thank you, Doc Cora, for encouraging us to continue learning together in our discussion today. It's a very unique discussion because it's about family support. The past months we've been talking about various topics, mostly from doctors who were sharing their insights on how to handle long COVID from the medical perspective. But of course, we know that there is the aspect of the family that we should also discuss. It's not just the physical aspect. So I would like to call on first one to share, who's none other than my dad, Doc Jimmy Galvez Tan. So those who don't know him, well, let me introduce him more formally. So Dr. Jimmy is the founder and chairman of Health Features Foundation Incorporated, the one who organized this webinar. It's been 25 years, yes, since HFI was established. Thank God for that. He is an integrative medicine specialist who has solid grassroots community work in far-flung doctorless rural areas. He's also an expert in the following areas: national and international health planning and programming, national health policy development, among others. He's also an advocate of Philippine medicinal plants, integrative Filipino treatment modalities, and has formulated various concoctions of herbal medicine. My dad, Doc Jimmy, served as the Philippine Department of Health Secretary in 1995, and also prior to that, an Undersecretary and Chief of Staff from 1992 to 1994. He also served as the Regional Advisor in Health and Nutrition for East Asia and the Pacific of UNICEF Bangkok in 1996. So let's welcome Doc Jimmy, who's our first sharer, and I'll be sharing after him. He will be sharing the role of family support in caring for long COVID patients, such as my mom. So Doc Jimmy. Yes. Doc Jimmy, you have to unmute and turn on your video so we can hear you. Yes. Kindly turn on your video, Doc Jimmy. There, we can see.
Yes, good afternoon. Magandang hapon po sa inyo lahat and welcome to this webinar. Thank you for attending this.
Yeah.
And yes, let me start to share my family. Yes, now you're seeing my family there. And Bex, as you have heard, is my wife, of course, for 43 years, nearly now 44. And yes, the whole family was affected by the long COVID. Long COVID now, 18 months. Wow, since the first COVID infection of my wife, Bex. So it's been 18 months, so just think about that. It's really long, not only long, but long COVID. Now, why did God create families? Probably just to say, what is the real role of families? And every family in God's masterpiece, ultimately, the purpose of having a family is to reflect God's love, to reveal his character, and for his glory. When we receive God's love for us, we're able to love our families the way God wants us to. Do you serve your family with delight because you enjoy it, or do you serve because it is a duty, because you have to? Yeah, sa akin po parehong delight and duty. Sabay po yun. God is providing a unique opportunity for you to love more intentionally your family member who is going through long COVID. So what are your top priorities? And is it God and family and work, or work and work and work? You won't be able to provide the support of your loved one because your loved one needs if your priorities are in the wrong order. So family support is not just one aspect. I'd like to introduce the 8 dimensions of wellness. So even World Health Organization just say physical, mental, and social. But I'd like to add the emotional, the spiritual, the environmental, the occupational, as well as the aspect of financial wellness. So I'll just like to give example in terms of family support. So physical, we have to really give priority in what the patient feels, and probably because we as the family member are the best monitor, whether to take the temperature or the blood pressure and other similar things, ensuring that really the physical health of the patient, the long COVID, kami sa pamilya, sinisigurado natin na maayos. And that takes care also of the whole physical, pati yung paliligo, and basic hygiene and all of that. So yan, siguro yan ang mas maraming nagbibigay ng attention sa lahat. Pero yung mental, okay, how do we give family support for mental health? This is really acknowledging the patient's mindset. Pag sinabi niyang, nalulungkot ako, parang ako ay disturbed, pakinggan natin, give attention to such words. And frustrated ako, yung mga ganyan. No? Hindi baliwalain to, hindi yung kagaya marami nagsasabi, naku, arte-arte lang yan. Huwag mong pansinin. Hindi. In fact, we should really give attention to every word that the patient mentions. And to show it, you really even have to ask for it. Ask, what are you feeling now? So that's very important for us to get to support the mental health. As we very well know in COVID, mental health really is a big component. Not only for those who are sick, but for those, we were all affected. The whole world was affected. And therefore, this is one of the, in a sense, for healthcare, it's one of the best things that happened, that we were able to surface out mental. But in terms of family support, every family member, including household help, or if you have an extra nursing care, to give full attention to the language that the long COVID patient has. Social, yes, social health and wellness is really relationship, how to strengthen that. At we cannot avoid that it is as if tayo yung hindi pinapansin ng pasyente. But it's one of those things that if a patient is in total discomfort, a patient has a lot of issues mentally, and there are so much pain, so much difficulty in breathing. Of course, there will be challenges to our social heal our relationship. So I think for me, what is best is strengthening the relationship rather than the long COVID becoming the start of an argument, for example. Keep in mind that It's supposed to strengthen the solidarity of the family. Importante po yun. Again, emotional, I'd like to distinguish mental from emotional. So yung emotional, kasi mental is from the mind. Yung alertness then, very important. The focus, alert or alertness, but in emotional, this is in terms of handling anger, dahil nga bakit ganito, or even challenging our Lord God, and why am I having this? Nakahanda tayong sagutin. No? Or if not, keep in mind, take note of what your family member who has long COVID is saying. Again, kung ito naman ay mabait, siyempre, meron naman talagang kayang-kaya niya persevering, enduring, and really taking it in all positive side. We give our support. Yes, tuloy niyo yan. Ganyan. Congratulations for your perseverance. So isa rin yun, no? Yung aside from recognizing yung language, kung meron rin naman nakikita tayong kabutihan na nadadama ng pasyente, also acknowledge it, and in fact, give it more attention. Spiritual, now is the time for the family to turn spiritual. If you have not been praying together, now is the time. If you have not been reading verses from the Bible to inspire patience, because there are a lot. And right now when you open your Google or social media, you just ask for inspirational messages from Bible verses. You can now easily access it in case you don't know what to do and what to say. And this could be very challenging in terms of usually, gano'n nga yung sa mga pasyenteng may COVID or long COVID, bakit ako, Panginoon? Again, all this feeling of whether negative feelings about the Lord God, but this time we give our support to that God is truly loving us, and therefore, and even Jesus Christ sacrificing his death on the cross, shedding his blood for our sins. And therefore, the resurrection provides also the inspiration for us in the spiritual life of a patient. I mentioned also here financial health and wellness is now one of the 8 dimensions. And of course, I know this is one of the most challenging aspects of long COVID. Dahil talagang maraming gastos. If you need a private duty nurse, kung kailangan ng oxygen on the long term, if you really need so much kind of support, sometimes you may need a wheelchair. Pwedeng minsan wala, pero it is an access that is very special in terms of, but all of these are really financial challenges, mahaba, and this is where you have to mobilize even your friends. And we'd like to thank all friends were really helpful during the period, particularly of COVID, when literally the first 3 months or even up to 6 months were very, very challenging because of the difficulty in breathing and the different feelings, as well as the mental fog that has been there. Now, I also place here occupational. Yes, we were all affected. And this is where, for me, for example, I had to cancel all my travels, limit my speaking engagements, and even webinars in the business to give more time to my wife um, which was in a real non-long COVID situation. Maybe you just say work, work, and work. But this time it's really the understanding of the family and in terms of occupation. And even my wife had to uh, temporarily stop her role as executive director of Health Futures Foundation. So I know that in most families with COVID, this is one of the challenging, the financial as well as occupational, as I was saying, because even families are doing that. Then the environment, I'd like to just make that environment, wellness, and health are also very important. Meaning to say, kaya ba yung kwarto, maayos, I hope you have a garden, or if you have the chance to have plants or even flowers. It's part of the whole environment. Keeping the room always clean and neat. These are all part of when I talk of environment. Not only the room, but eventually, of course, the whole house and the whole place where we are living. Dapat po talaga yung ating kapaligiran, ang ating kalikasan, naaalaga pa rin. So these are the 8 dimensions of health and wellness, but they are also the 8 dimensions in taking care of our long COVID patient in the family. And this is, you have this as a checklist. Am I really doing my role in the family in caring for long COVID patient? I'd like now to turn over the part 2 of this sharing of my family in support of long COVID of my wife Bex to my daughter. Yes, you've met her already. So Riva, take it away.
Yes, thank you, Dr. Me, for sharing with us the various aspects of our family support. Yeah, so now you know it's not just one aspect. It's not just addressing the physical needs, but like my dad said, there are 7 other dimensions. So on my end, I'd like to share for those of you who haven't encountered the 5 love languages by Gary Chapman. This is one model I wanted to share with each one. Intentional support through 5 love languages. So each person has a different love language, and the first thing to know is what is your family member's love language, because you can be doing so many things for them to support them, but it's probably not what they appreciate the most. I'm not saying they won't appreciate it, but there are different ways that people receive such love language. It's a matter of really understanding first what would be helpful to them. And it could be as straightforward as asking what would be most helpful and what is not helpful. So I often ask my mom that question because I'm also the type to suggest things for her, but sometimes it's not something she likes to do. So I have to be sensitive to what she says. So the 5 love languages, for those of you who are familiar with it, and those who aren't, I put it here. Words of affirmation, physical touch, receiving gifts, quality time, and acts of service. So this is a generic chart. And I know during COVID times, it was so hard to do physical touch, like hugging and holding hands or just being close to each other. But by God's grace, there are other ways to show that affection to family members, especially if that's their love language. It helps so much really in the person's well-being. So words of affirmation, it's not so much saying that things will be okay, because things are not okay at the moment. So it's really more of encouraging your family member with what they have. For example, done or have gone through so far. Like I tell my mom, feel less down the things that you used to do before, that you couldn't do. I mean, when she was fresh out of the hospital, she didn't even have that ability that time to eat on her own or walk on her own or just stand on her own. So just recalling those times and how far God has brought her to where she is. So that kind of encouragement, or encouraging her with God's promise of, how uh, her suffering is not for nothing. It's very purposeful. And I always shared with my mom how God really uses this time of long COVID to continuously mold and shape our character. So yeah, most of the time, the mindset is to get out of long COVID. And to be honest, it's it's ideal that my mom would get out of it and be completely physically healed. We know that it's really only God's timing. So while we're in this journey, my goal personally as a daughter is not to to make a false promise that, yeah, mom, you're gonna get out of this soon, but it's really more of being there to journey with her no matter how long it takes. So here it says some concrete actions to take, like an unexpected note, text or card, or sometimes a voice note. When my mom was in the hospital, this was when she was going through COVID. I recorded some songs for her that remind us of God's faithfulness, His love, and all the other things that we usually forget about God's work when we're sick. So though I don't really sing, I did it for her out of love for her. So being that creative, it's really God's wisdom that led me to do that for my mom. So genuinely encouraging and doing it often. So there is no such thing as over encouragement. As long as, of course, your motive is to really encourage, not just to say something for the sake of it. And part of affirming is also listening actively, not just talking or writing. And for receiving gifts, of course, I know what my mom likes, especially she's a foodie, a food person. So when I bring her favorite food, it gives her so much joy. Though I know she also has to manage her weight due to her COVID, long COVID, yeah, or post COVID effects, also is gaining weight. So for her own health and well-being, yeah, that's part of my role also, and not giving all the food that she wants to eat, but timing it. There's a time for everything. It's not always the time to eat everything she likes, as I know it won't be beneficial to her as well. So yeah, again, it's different for every person. So the key is to know that very specifically. And for quality time, of course, it's hard to really plan travels. Like our family used to travel very often together, but because of the pandemic and my mom having long COVID, it's been very challenging. Although last year we were able to bring her to the beach, which she really liked. So those are moments that she really looks forward to, the sea breeze and just being away from the city. So yeah, there are ways to do it. So we had portable oxygen tank that time, and we had an oxygenator in the room. So I know it's a lot of work, but it's worth going through, of course, to encourage our long COVID patients, or in this case, my mom. And of course, even just being at home, it doesn't have to be a major trip right away. Depends on the condition of the patient, but creating special moments at home, or having that time to bond and not just coexist in the house. Because you can be in the same house, but you're not really talking to each other, right? Or you're just there to interact when you need to. So this is a more intentional quality time, one-on-one time, or together as a family. Acts of service. So yeah, doing chores definitely. We don't have a helper at home, so definitely this is something I had to do, or I'm still doing most of the time. So yeah, and if my mom, of course, she couldn't do as much chores, and she couldn't really move as much prior to her getting a bit better in this stage. But yeah, I do have to do some of the chores. Of course, I ask for help because I can't do everything. And that's also important, asking for help from others. So yeah, it's basically looking for ways, not just household chores, other acts of service, buying her medicine, arranging, therapy, physical therapy for her, and all those other things. So basically, it's coordinating uh, a lot of things that she needs. But I'm really delighted, as my dad also asked earlier, am I delighted? Yes, I do. I'm delighted to do this. So yeah, these are just some examples of how we can support them in various ways. And like I said, the most important is to find out first what is most helpful. Some other tips. Well, I used to be a very reactive person. I am not really much of a planner, but because of what happened to my mom, I learned to be more proactive and forward thinking. It's not really my strength. So it's an encouragement to family members. Yeah, for those who think like, oh, I'm not the type to do those things. To be honest, like I'm not able to do anything for my mom if wasn't I mean, if I didn't rely on God, if I weren't really open to being changed by God to be more loving to her. So yeah, being proactive means, well, as you see in the photo, well, holding an umbrella versus like, oh, it just rained, so I just have to cover myself. So I have to think ahead of what my mom needs, and be proactive about responding to those needs. So there are times, honestly, I still forget that she needs to do something. Let's say one of the exercises, for example, she was doing before, I was like, oh, I didn't get the reminder about it. And sometimes I forget as well, but yeah, it helps to put an alarm or have a reminder in check. Yeah, so these are some things that we need to be more intentional about, because really, if it were myself before, I tend to forget all these things. So I have to be more uh, intentional to put it on the calendar or my phone. Next is, well, being emphatic, not just sympathetic. So, well, the difference between sympathy and empathy. Well, sympathy is more of, well, yeah, that is the picture says, I'm sorry, that must hurt, but not really putting myself in the shoes of another person. It's just, oh, okay, you feel that way. That must be hard. But empathy is really putting myself in the shoes of my mom. And of course, I will not ever feel the way she feels, but just really immersing myself in that environment, internalizing like how does it feel for a person, especially for my mom who used to be so fast in doing things, and now she's doing everything much much slower. So it's another frustration for her. And I told her that it's really thinking about what she is able to do versus what she's not able to do anymore. Because as of today, she's still able to do basic things like showering. She's able to cook now, and she's able to fix the house, and this she likes to do as well. So uh, it's very challenging for her not to be able to go back to her regular programming. But like I said earlier, the goal is not to go back to the regular programming, but to maximize what we have right now and what we're able to do at this kind of journey that we're in. I mean, in this journey. So, yeah, it's not natural for people to be emphatic, and I'm also not a very emphatic person, to be honest. But by God's transformation, I also learned to put myself in my mom's shoes, and that helps me care for her, because I don't end up minimizing how she feels, which leads me to my next point. One thing I also learned is to acknowledge, like what my dad said earlier, also not invalidate. So what are some examples of this? Well, invalidation is like, oh, it could have been worse. Or if I tend to compare her, like, mom, you're better off than other people. But it's not about comparing her situation with others. I know it's tempting, but unhealthy comparison for that matter, leads to uh feeling insecure, either, or feeling too proud that, oh yeah, I'm better than them or I'm worse than them. So it's not a matter of who's better, who's worse, who got better, who's doing well, who's not doing well. It's more of just understanding her. Yeah, sorry that happened to you. I'm sorry that you feel that way. Or yeah, it's not trying to make her feel better by just saying some words that, oh, it's okay, it should have been this and that. Or saying, oh, you make a big deal out of everything. Instead of saying that, you can say, oh, that sounds really difficult, or how can I help you with that? Or saying, oh, you'll get over it at some point, you'll be okay. But she's not okay right now, so what do I do, right? So it's saying, I care about you, what can I do to help? I said earlier. And then you can also say, of course, this is not what you want to say, like, oh, you take everything so personally, and you're so sensitive. So I'd rather say, I'm sorry, I didn't realize how much that affected you. How can I improve? What do you want me to do next time? I want to understand what you're feeling. And then, instead of asking her, why are you so angry? And it's matter of acknowledging that, oh, I know this makes you feel angry because of this and that. So it's a never ending understanding. But it's good because that's how we get to love one another more, really, by seeking to understand rather than being understood. So it's really not about me, but all about how God wants me to love my family, especially my mom, in this long COVID journey. What is the value of validation? So there's a healthy kind of validation. Okay. Like I said, there are invalidating statements that I mentioned earlier, and I won't repeat. But you can see it in this chart. So validating statements say, like, it must be really painful. Uh, I feel how upset you are. Yeah, and so on and so forth. So there's a value in it because it makes the other person feel that you're listening to them, instead of just trying to be ultra positive but not rooted in reality. It's okay to encourage person and to make them look forward to say something that's really encouraging for them, but not to the point of dismissing how they feel right now. And of course, it's important to know the pain points. So what are the pain points? Well, these are the points that give my mom pain. So whether physically, yeah, she has her physical pain points, or emotionally, mentally, uh, relationally, spiritually. So we all have our pain points. And one of the roles I take is to be aware when I'm triggering my mom, and when to stop inflicting more pain. So it's easy to overlook that, especially when, for me on my end, like, oh, I really want to help her, but sometimes some things I do, like I said, are not helpful anymore because it's something that my mom is not really, let's say, in the mood for. So I have to really be more and more intentional to know that, so that I will avoid it, the pain points. Yeah. And what helps also, well, my mom has her body aches up to now as part of the post-COVID effect. So we have this time of well, having her virgin coconut oil with her essential oils, and just making sure that she feels better with the touch therapy and things like that. So yeah, again, it's different per person, but the point is to know very well what the pain points are, the love languages are, what would really help, but would not help. And it's an ongoing learning. So it's not just, one time listing it down and then that's it. So even after 18 months, there's still something new I learn every day. It will also help. Part of our role is to have a gratitude journal. So list down what you thank God for. So even the little things, like I remind my mom, mom, you were able to do this today. And sometimes she gets frustrated because she only did an activity that sounded or seemed so simple, but she's so tired already. So I remind her, mom, one day at a time. You know, remember last time you weren't able to do that, so we thank God that we're able to do that today. And even times when we're just my mom's just in bed in her crash. She has a thing called the crash. When she crashes after doing an activity, she just stays in bed. And for some people, they think like that's so miserable. You're just in bed, but that's something to thank God for. Like, thank God I have a bed. I have a home where I can hang out, have all these things. But more than just the things, we thank God that we can be in His presence, that we have Him to journey with us. So that's really the most important. But yeah, little and big things, listing it down every day and talking about it helps so much to remember what we are thanking God for. And of course, focusing on God's promises. Because to be honest, for me, I cannot promise my mom, you're going to get well for sure, because I'm not God and only God knows that. And whenever she asks, like, until when is she going to go through this, I really don't know. And I don't have an answer. And sometimes it's okay not to have an answer. We don't always have to answer, oh, yeah, soon, and then I'm not sure if it's really the case. So I'd rather redirect my mom to God's promises that indeed this long COVID journey is temporary, but we have so much that God has promised us, that He will not leave us nor forsake us in this valley that we're in. And more than the physical healing, there's so much healing that's happening emotionally, spiritually, mentally. So sometimes we just focus on the physical, right? But we are whole people, so we shouldn't just focus on that part. We focus on what God has promised us, and more importantly, this time of journeying with a long COVID patient like my mom, I've learned so much also that it's not really about having a fast recovery, but having a slow recovery is okay as well, because it gives us an opportunity to really treasure each other, because it's slow, everything's slow in this fast-paced world. Everything's so fast, and we're too busy to even think about others' needs as intentional as God wants to be. So having this slow recovery for my mom has brought us to really rely on God and have more time together, which I know most of us don't have when we're busy and doing other things. So yeah. And to end, well, just a loving reminder, pride gets us into trouble and humility gets us out of trouble. So every time I'm uh being attacked with my own selfishness and pride, that's when I don't get to fulfill my role in caring for my mom, because I just think of myself. I mean, it's okay, of course, to take care of yourselves as the one taking care of your other loved ones. But when I say selfishness, I just think of myself and I don't think of other people at all. So that pride gets me into trouble and it affects my family. So it's really humility from the Lord that makes me admit my mistakes and really have a new heart to serve my mom, serve my parents, serve my family. So it's really constantly reflecting on, what did I do today? Was this helpful? Did this really encourage my mom? So I really evaluate also each day. I don't let it pile up. And I'm not saying that all of you should do that, but it really helps to reflect on what to start, stop, and continue on a regular basis. And lastly, my question is, where are you rooted in? So there's a stark contrast here for me as a Christian. So the characteristics of the fruit of the Spirit, there's kindness, goodness, joy, faithfulness, peace, gentleness, patience, self-control, love. And I'm not perfect in all these, but thank God He equips me with these to take care of my mom, take care of my dad, my family. And the opposite of all these works of the flesh are selfishness. So that's enmity, doubts, fight, gossip, disobedience, addiction, envy, grudges, lies. So And I pray that I won't fall into that tree. There are two trees here. So the tree of life, the life-giving tree, and the other the evil tree. So yes, we all will struggle with, being patient, being kind. It's not natural, but yes, as I've shared, it's something God produces in us. Personally, in my relationship with God, it's changed so much how I treat my parents, how I treat my mom. And if you ask me, how I'm doing all this, I'm really running on God's energy, because on my own, I will run out of energy, really. So the characteristics of a loving family member, as I mentioned, the fruit of the spirit. So seeking the highest good of my mom. So thinking what is best for her, gladness that is not based on circumstances. So yeah, there are times it's really hard and there's a tendency to want to give up. But yeah, the joy of knowing that God is journeying with us, that He sustains us. There's gladness even when there's difficulty. I'm not saying that we don't have problems. We have a lot of problems still, it's not over, but we have that peace that transcends understanding, the knowing that, God uh really loves us, accepts us, forgives us. We can also know that whenever this journey ends, we don't know when, we can be at peace with God, knowing that He's the one in control of this whole journey, and our role is to cooperate with Him, and we can have that peace regardless of the circumstance. So patience, being slow to speak, slow to anger. I used to be so fast to speak, slow to listen. So I'm learning that. And kindness, being merciful, being, forgiving. I know my mom also is a very forgiving person. My dad, they model that to me. Just as God has shown me so much forgiveness and extended that to me, I can extend that to my family as well. Because there will be conflicts for sure. You can't avoid that. It's not something we can totally get rid of. Like I do have those things I need to look at in my own heart. Why am I impatient? Why am I, not as kind as I would want to be? And so being generous, being open-hearted, being dependable, loyal, trusting, humble, non-threatening, calm, behaving well. Self-control is not acting on my emotion, but really praying first and asking God what He wants me to see. Sometimes I am also tempted to say other words that are not helpful. So yeah, it really boils down to first, um, having God screen everything I do. Is this something that I ought to do for my mom? So before I go to the Q&A, I'd like to read a short paragraph. Well, actually, my mom wrote this last month. She wrote a piece called "Rising from the Grave of Long COVID." So long COVID has been my mom's Calvary in that sense. So she has been experiencing it for the last 16, 17 months, crawling under the burden of the cross of breathlessness, crashing even on very minor exertions like combing her hair, severe muscle cramps and fatigue, almost zero energy, and an ending pell-mell in a myriad of other post-COVID sequelae symptoms. So life with long COVID has been filled with anguish, frustration, exasperation. My mom had her moments of like being in the Garden of Gethsemane. The agony of the physical havoc of COVID-19 seems so unbearable to her. She has been crying out to God. I know it's been hard, but it's really a journey that brings us to have that mindset of, you know, understanding God's perspective in all of this, like why He's allowing this. And it's very, very purposeful. So I will not read her entire piece, but can access it maybe later. I send the link to it. Yes. So now we'll proceed to our Q&A. We have a special guest also joining us. She's also one of the people who's encouraged me with taking care of her husband who also had COVID, and she also had COVID. I know. So Cricket, I want to welcome Cricket Del Castillo. Cricket, thank you for joining us.
Thank you for inviting me too.
Yes, yeah. So I know Cricket, your journey, and that's why I asked you to join us today because it's a very encouraging journey as well. So share with us first, Cricket, as a wife. What did you do to be more intentional about taking care of your husband Ricky after he had COVID? Or you can share with
Okay.
us also his COVID story.
Okay. Yeah, we'll start from the my husband had severe COVID. He was hospitalized for 26 days. And during his confinement, I was also asked I needed to be hospitalized as well for 10 days. But prior to that, when I took him to the hospital, I signed a contract stating that I would not be allowed to leave his room during the duration of his stay. That's why the day that they told me they had to admit me, I remember still now crying at the emergency room and telling them that if you put us in two separate rooms, we're telling you we won't get well. We have to be together. So the hospital admin had to meet, and finally they agreed to put us in one room, which was the semi-private room in Manila Medical. So I was his sole care provider. And I remember, when you're in a COVID ward, it's so lonely, you're so isolated. When the beeps of the high flow goes on, the nurses don't hear it. There's too many isolation barriers. So I remember walking around the room carrying my IV just to take care of my husband. And then he also had he could not walk. He could not walk. So I had to carry the portable potty to him. I had to We had to use the urinal. So I was really the one who took care of him more than the nurses. I became his nurse. I was his special nurse. And to be honest with you, there was no regrets. I would do it all over that way. So anyway, after 26, I just wanted to share that my husband and I were really determined about everything because he had two instances when he needed to be intubated and he didn't want it. He said, no, if you're talking to me now, it means that I am still okay. So we fought through that. So I was hospitalized 10 days. And of course, the agreement said I can't leave the hospital until he was finally um, allowed. It took 26 days. And on the last day, we had an agreement with the doctor that he could only go home if we had an oxygen concentrator of our own, a full tank of oxygen just in case we lose electricity. We had the oxygen concentrator. I had to buy a um, portable oxygen tank for the bathroom when the time comes when he can walk. And we had the portable oxygen tank again that we would use it when he goes to the doctor. So it was not only preparing to go home was very difficult because we had to prepare the house, we had to defog the house, we needed an air purifier, setting up all the oxygen tanks in the house. And then we had to buy a portable potty, then we had the urinal, everything. It was like bringing the hospital home. And I remember, Riva, you told me the same way was for your mom, right? You had to set up a hospital for her. And of course, what did I do intentionally? I had to prioritize him above everything. I remember when he was sick, I would not sleep. I know this was not right for me to do, but I did not sleep at night because I knew at night the nurses would not do a check. So I would be awake the whole night. I would watch him even at home. And then during the day, I would intentionally take melatonin so it would be my time to sleep. But really going back, there was nothing that I would not do. I'm sure you and your dad would do the same. Then you talked about the love language. And
Yeah.
I just realized his love language is quality time. But it's not only quality time, he wants 100% attention. It means if you're in the room, you can't be using the computer when he was sick. He wants you to be with him. So he said that the biggest thing that helped him was my making him laugh, telling him stories, trying to be positive. And to be honest with you, I think we survived COVID because of each other's company. And I think I remember there were downs, a lot of downs in the hospital, but you really have to give him all the love and attention, and you have to smile even if you want to cry. So that was the most intentional that I had to do. Thank you.
Thank you, Cricket. Wow. Truly loving radically.
Oh yes, radical love. Yeah.
uh, Going out of your way. Yeah, that's number one. Most of the time, we
Yeah.
stay in our comfort zone, right? So I
And
know.
it was so very sad that the environment, I think the people that don't survive COVID are those that are left unattended.
Yes. Well, of course, only God knows really, right? Who.
Yes, you're right. You're right.
But yeah, I understand because there is a study also cricket. Of course, fellowship, relationship, definitely it brings different uh, impact to our health. So I know there are people who were isolated and it made them really sad
Oh,
and
it was so sad.
very difficult. So we feel for the families also who were isolated from their
Yes.
loved ones. And I know of some people who they didn't see their loved ones anymore after
Yes.
it.
We
So
were just lucky that
yeah,
Manila Medical allowed a family to stay with
yeah,
the sick person, and I was sick too. And to
yeah,
add up, we were actually three in the family who were confined in the same hospital because my father-in-law got sick after both of us. So
yes, yes. I understand. There, that wasn't just your husband, but your father-in-law.
yes, it was also my father-in-law. Actually, in our household, it was 5 out of 5 that got it.
Okay, okay. Yeah, thank you. So what a challenge.
A
5 out of 5.
very big.
Yeah. So
Yes.
what difficulties did you face during the post-COVID recovery, and how did you deal with it? And also for your the rest of your family also. I mean, I know it wasn't just you, but everyone had to deal with it. What were the difficulties and
Actually, the most difficult part was when my father-in-law went home after COVID. He was a totally different person. He had dementia prior to COVID, but when he came home, it was like day and night. He totally lost his dementia became severe, and his Parkinson's started. And my husband was my father-in-law's main care provider. So can you imagine that my husband was confined to our bedroom and my father-in-law was in the other room. So I had to take care. Actually, he had a caregiver, but still you need to be taking care of my father-in-law, to watch how he's doing and everything. I was in charge of buying whatever he needed. But the most painful thing happened that we lost him. um, we got sick in April. All of us were hospitalized in May, and he passed away in July. And it
mm,
was because of I feel that COVID destroys the most vulnerable organ of your body. Because for me, it destroyed. I have psoriasis inborn. So during when I had COVID, my whole body was covered with it. That was my weakest point. So my
mm,
husband, it was his lungs and his kidneys. And for my father-in-law, it was his brain.
oh my, yeah.
And the most difficult, is taking care of his everything about his funeral while my husband was sick at home. You
That's
know
a
how difficult that was. I have to be with my husband, yet part of me has to be at the. We did, of course, it was COVID, so there was no funeral or anything. But still, having the cremation and everything, and then taking care of my husband. So we lost him July 25, 2021, only 2 months after COVID. And then when he passed away, my husband got sick again. And I said his kidney started to get sick. He started passing stones.
Oh my.
And it's so difficult to transport my husband because we have to bring the whole, the tank and everything. And yeah, the good thing is he didn't want to be confined once again. So we went home and everything was done at home, his medications and everything. So the most difficult part for everybody was first dealing with the death of my father-in-law, and how I would do it without his children, because my in-laws are all in the United States.
Mm.
And it was only my husband who was here. And at that time I had to do everything. So it was so painful. So a very painful experience for us. And it was only my youngest son with me. So my son had to grow up as well,
Mm.
because there were things that I had to be with his dad, and he had to, like, picking up the urn. It had to be my son. Logistics like that. We had to learn to do
Yeah,
things as a family.
it's so
Although it was so painful, all my children, we became a stronger family because my daughters are in the United States. They check on us every day. Things that they didn't do when we were in the United States, they were doing to us here. They were calling us every day. We started having our Bible group as a family. I
Mm.
mean, the Lord, things happen for a reason. And the biggest reason is for us to surrender our lives to God. And that is how I look at this. Because, thinking of the finances, like your dad explained,
Yeah.
there's really a lot that you spend for. You have to, first of all, you need your family. We became close, the children, my extended family, my siblings, all of them were with us, and especially the church. My D group was with me. So despite of all the hardships, and Riva, during the time that we had COVID, it was the time when um, the wife of Pastor Rick Sarto passed away.
Oh yeah.
So
Oh.
it was a scary event because you hear a lot of deaths happening while we were also sick.
Yeah, a lot of people we knew also were were having COVID, and next thing we know, there's an announcement of the death. So yeah, it's very very difficult. Can imagine, and for your family because
We had death, yeah.
your father-in-law. So yeah, what helpful encouragement did you receive, Kirkit? Especially, I mean, up to now, I know it's not yet over. I mean, we're both dealing with the post-COVID effects still.
Yes. For me, the biggest encouragement really is our faith, because
Mm,
we are so rooted to our faith.
yeah.
And with the faith comes the
Mm.
church and the discipleship group. And as I met you through
And the community.
Life to the Max. So you meet people, you meet people, the family's a lot stronger, you
Mm.
know, you but one thing that I want to share that is you always have to listen to your body and listen to your instincts. The people who are here, sometimes we think, oh, there's no more COVID, that's nothing,
Yeah.
because that happened to me.
Mm.
April 2023, I decided to attend an event. I won't mention the event, but during that event, I was wearing a mask 95% of the time. However, I forgot that you should not be eating with other people.
Yeah.
And during pictures, you should still wear your mask. Because I had COVID too, but he was more affected. He's like your mom. His lungs was damaged from the lower part, right, of the lungs is damaged. So we were told by his doctor that my husband cannot get COVID, of course, but he cannot have another bout with pneumonia,
Yeah.
because
An
it may,
infection. Yeah, for that matter.
yes, he cannot have pneumonia anymore. It will be, I may lose him the next time. But me, I wanted to experience an event. I honestly, we barely leave the house, and I said, this event will be the event that I'll attend. And
Yeah.
surely, the third day after attending that event, I had sore throat.
Uh,
And I didn't know. You think, oh, sore throat, maybe it's nothing. But you have to listen to your body. It's very important for us, taking care of long COVID patients, that we really have, when we feel something bad, oh, it's not little cold, it's not little
yeah.
cough, it's not a plain sore throat. Test yourself.
Yes.
Take a COVID antigen. And I did. I
Yeah.
did do that.
Don't
And
underestimate, right?
so that's the other important take that people have to learn is do not take anything for granted. Because what small COVID, people, because, oh, COVID's nothing, it's just the flu. No, it's not. Okay. So when you feel something's wrong with you, take the antigen test.
Yeah,
Because we love, like for you and your dad,
yeah,
because of your mom, you really have to watch what you do. And I
yes.
was so careless. That's a very big confession that I have to make. I was very careless. So
Well, thank God, Cricket, that he's a forgiving and merciful, gracious God. So you have
yes.
opportunity to learn from what you've gone through. Of course, as I've shared earlier, we also are not perfect uh, family members, right? But it's, of course, it's not a license to just do whatever we want.
Right. And I learned it the hard way. I think I learned it the hard way because sometimes I get impatient, and you get bored, you want to go out, but that would be the last time.
To manage the risks, really.
Yes,
I mean,
yes.
of course, at some point we'll have to go out, but there are risks that we have to.
Like that in a confined environment with so many people, I should
Yeah,
not be there.
with hundreds, right?
Yes, hundreds.
Uh, Cricket, the good thing is you have a humble heart to learn. I think that's another important role for a family member, a role of being humble and
Yes.
not so. Okay, a lot of people think humility is thinking less of ourselves, but it's actually thinking uh, of others more.
Yes, yes, true.
Yeah, that's something we have to keep on learning, of course, because of our selfish nature. So, thank God that He's given the heart to really reach out to our family members as well. So, Cricket, what encouragement would you like to give to others who are listening right now who might be having a hard time journeying? I mean, we all have our struggles, right? What would you like to share them?
For me, the most important is keeping in this mind that you are not alone.
Yeah.
Always remember that God is with us and will never leave us and forsake us. And I'll read you my favorite passage, which is
Sure.
Proverbs 3, verse 5 to 6. Trust in the Lord with all your heart and do not lean on your own understanding. In all your ways, acknowledge Him, and He will make straight your path.
Yeah.
So because of everyone's family resilience, those who are listening now, because of your love and support for your loved one, I assure you that that if we continue what we're doing, there will be better days. We
Yeah.
just have to be resilient, patient. Yeah, like everything about the Holy Spirit, we just need
Yes.
to love, peace, joy, patience. The hardest for me, kindness, goodness, faithfulness, and gentleness, and self control. See, for me, self control, because my husband said the day that I went out, please stay home. You might get COVID. And I didn't listen. But
Uh,
that's the only thing. If we just follow,
yes, yes. Yeah,
just follow.
die to our desires, right?
Yes, and really, the gifts of the Holy Spirit is the biggest inspiration that we can give other people because everything's there, right?
Yes.
The seven
And
gifts.
it's also more of being yeah, like you said, cricket wise. I'm not saying don't go out at all ever, right? But of course you have to look at the risk and of course take
Like
the
what when I
cost.
spoke to your mom, she just said that don't go to confined places,
Yeah. And
like
when
don't,
she meets with her friends, because of course she wanted to see some of her friends, it's always outdoor and
yes.
there's
Like the beach is a good example of,
yeah.
Ricky, you said you haven't traveled. Ricky and I traveled. We went to visit our children, but we wore our mask, yeah,
Oh,
the whole time. And then there's a lot of open space during close confinement. We wore our masks, so we just followed the protocols, and we actually did well.
okay. Yes. It's of course our immunity as well. So cricket, I'm sure in that event you were so tired
Oh
also.
yes,
So
very tired.
contributed to to
Yeah, and I should honestly be thinking of him because I have his blood test every 6 months, and his lymphocytes are still low, which means he's still prone to infection. So I should really use my, God gave me wisdom. I should use it more.
moment. Yeah, it's okay. We have those moments, and like I said, thank God that we can learn from it, and we're not stuck there. So thank you for the
Yes.
encouragement, Cricket. And I like what you said, Cricket, earlier about your family really drawing closer together, first to each other, and of course, each one drawing closer to God, because otherwise, if you didn't have this long COVID thing, maybe you wouldn't be
True.
communicating as often, right?
Yes.
So that's why I always encourage people who are also going through this journey that it's actually a privilege that we have, right?
Yes.
To have this time of more intentional communication and having time together that that you usually wouldn't have because maybe if if everyone's doing something and they're busy, they can't really have that time together, like
Yes.
for every family. So thank you, Cricket, for sharing that with us, your experience, and truly, you are anchored. Your faith is anchored in the right anchor. Because sometimes, people tell me, "Oh, I have great faith," but if your faith is in the wrong anchor, it will also fall. So thank God we have
Yes,
our
you
solid.
do. Yes.
Nice, yeah. So we're open to questions. I'll call Doc Jimmy also to come. Forget you stay with us.
Okay.
Questions here. We have one here. I was the one who got COVID and I felt different. Like I'm not the old me, or maybe the old self. I'm always angry and gets irritated. Easily getting irritated. Hair loss was so bad that it became really thin. Although I'm functioning but can't accept being irritated almost every day. Does this happen to everyone? I easily get sick too. In the past, I don't easily get sick, but this year I easily get cough and cold tonsillitis, and like my memory is
Yes.
not as good as it was. So in short, there are a lot of changes and adjustments, right? And there's no name, so whomever typed this, I know that wow, it's something that you wouldn't want to experience again and again. But, I am really empathizing with you as well, that with how you feel. So yeah, does it happen to everyone? I think it
To
depends.
me, it does. Yeah, to me, it does. It did.
Are you more
Does
irritated?
happen to all.
Yes, Doc, right? Doc Jimmy, for me,
Yes,
it
yes.
does.
Yeah.
I think the key is to be aware of it, to be aware that you have become more irritated than ever. And
Yes.
I think the mere fact that to be aware of it and even to tell it, I think it's also on the part as patient. Um, I hope now that you have told us this in public, that you have also told your family members
Mm-hmm.
uh, that you I'm sorry I get so irritated so much, but it's part of the post-COVID
Yes.
behavior really. So, but
Understand.
the key is being aware of it, and once you're aware of it, probably you can. Your family members wants to serve you, but of course, if you're always irritated, also the key is that the cycle of love and forgiveness, and of
Yeah.
course,
Yeah.
pray that the pray that the irritation will go, and it will. I'd like
Yeah.
to say that if you pray and
Yeah. God
love and
help
forgive.
you. And replace with love and forgiveness. Thank you, Doc Jimmy. Thank you, Kit. Yeah, actually, that's why my mom also started this long COVID support group, because I know it's hard to journey alone. And as you said, Cricket, the one of the greatest encouragement is we are not doing this alone, because it's very difficult if you're doing it alone, and that's not what it's supposed to be. We are meant to bear one another's burdens, right? So there's a question here. What can you advise for tayo naman daw, the family members who are living with long COVID patients? How can we avoid burnout, taking care of our family members? How do you rest, Cricket? Or I mean, of course, there's sleep. I know you weren't sleeping in the hospital, but
Yeah, I wasn't sleeping there,
that was
but
of the past. But now, how do you avoid, getting also irritated from There's so much I have to
You
do.
know, I'm very like what Doc GB said, and I'm very active in church, so the church keeps me busy.
Yeah,
You know,
and
I try to keep a positive attitude. Like,
yeah,
I'm retired. I retired. So what I do is I'm active with my D group. So I prepare lots of stuff. So
yeah,
there's always something to do. I keep myself busy.
yeah. But with the right things also, not just for
Yes, yes. Not only Netflix. You know?
yeah, busy with purposeful work that the Lord has called you to do. So yeah,
Amen.
for me personally, it's having healthy boundaries as well. So of course, as much as I want to serve my mom 24/7, I also have to sleep 8 hours. As I myself, I had
Mhm.
COVID twice, and I'm the kind of person, if I or when I lack sleep, I really have low immunity, so I easily get sick. So that's why I have to protect that time, sleeping well, having my quiet time with God, having time also with friends. So I know I don't get to go out as much as before because I know I have to be cautious also. But just even on Zoom, having the time still
Mhm.
my other activities. But I tell my mom, of course, that there's time when she needs me and I'm there. And I also tell my dad that we have to make it, like teamwork. It's not just me, not just him, and even for my brother and my sister-in-law. So, yeah, Doc Jimmy, how do you avoid burnout for the ones caring?
No, really, I think all of us agree that sleep is still important. So, because even for me, sleep is medicine. So, for those who are burned out, please try to have at least 7 to 8 hours. I know it's difficult taking care of a long COVID patient, but that is the one thing that can really affect our own immunity and we will get sick ourselves. Secondly, of course, that you have time to eat. Kasi
Yeah.
most of those who really take care of their family members also fail to eat. But that would be one of the things. Of course, eating healthy. That's what I
Yes.
mean. And then
Fruits and
um,
vegetables.
I would still go to a lot of prayers and just like cricket, di ba?
Yours.
Actually, the past year I have increased my Bible study group from two to three.
Yes, yeah.
so,
The
so in
support
a
community.
sense,
Yeah.
and it gives you the power, it gives you the energy, the motivation, not to lose sight
Yes.
what are them. And then your D group, your Bible study group, really are also praying. Well, in this case for my wife, in this case, I hope. Well, I'm sure for your husband. I
Yes.
mean, in this low COVID journey,
Yeah.
I still say thank you to my Bible study group that they are still continuously praying for
Yeah.
the complete recovery of Bex.
Yes. Yeah. Because what burns us out also most of the time is trying to do things on our own. So there are delegatable tasks as well. So I've discussed this with my mom. I said, Mom, I can't really clean the whole house. I can, but I don't want to because it's a lot of work and that in itself is tiring. And if I think about it, what are the non-delegatable tasks? So for example, me as her daughter, I can't delegate that because I'm the only daughter and my dad's the only husband. So yeah, right. So we have specific roles that's just really for us versus let's say cleaning. That's something that we can assign to others and some other things that we can delegate. So it's nice to list down also what you can delegate, what you should ask others for help. Yeah, asking others for help would help you not to be burnt out, right? Don't wait till that time that you're the one who's in the hospital or you're the one who's sick till you ask for that help. Yeah, thank you for sharing, Doc Jimmy and Cricket. So here, how about those who have, well, financial problems? Oh, wait, this is very common, of course. How do you deal with this? Especially if you want to provide support, but you're financially challenged. So, Doc Jimmy, what are our options?
Here, of course, the key is some people, I found out in the COVID, as I told earlier, there were generosity was just overflowing. But because I think the main reason is that you were able to tell as many friends as you can that yes, we are all well. We all had COVID, but my wife was the one who had severe COVID and is suffering, and it was for us unimaginable that so many were able to help. So that's I think the first one because for some families they'd like to keep it to their own. They don't want to tell others, "Oy, nakakahiya, ibo-broadcast mo pa sa mga kay." Actually, there's nothing to be embarrassed about or to be ashamed of. COVID is COVID. Like in the COVID pandemic, everybody had COVID. So, well, I'm not saying that probably that the one who asked the question, maybe I'm just stating that if you have not informed as many people as possible, then even just informing them that you still, I mean, like one member of your family is having that long COVID, then when really everything talagang goes to having difficulty, particularly in hospitalization. Right now, I know it's difficult, but even right now, I heard that even private hospitals have this medical assistance program, and that's called MAIP. Just for those who are in the hospital, you can tap the resources of the Department of Health, who has a huge fund just to help people who are in need or yung talagang because it can be catastrophic in terms of your financial situation. So you can tap this. Then of course there is the Malasakit Center, just to mention that these are areas if in the hospital and even in outpatient, you can still access the MAIP and the Malasakit. And then the third one, of course, the Department of Social Welfare. Just in case you really run into heavy financial situation, challenges, these are some, in case you have not tapped it. I hope if ever what I gave and you have done it already and you are still in financial situation, keep on asking questions before we end the seminar. Thank
Yeah.
you.
Thank you, Doc Jimmy. Yeah, definitely we saw and we continue to see how God faithfully provides. And when Doc Jimmy mentioned about sharing with others, it's not that we're asking for attention. It's just really sharing with them what we're
First
going
of all, to pray, really.
to pray. And when we pray, it's God who works. So we saw him work and he's continuing to work. Even some of our oxygenators were given to us or lent to us. Surprisingly, we just saw it delivered here. So we thank God for all our supporters, our generous helpers, I mean friends, and even some people we don't really know. So yeah, how about Cricket? How was the experience for you in terms of the help that you receive?
Um, Actually, it came from my son. He's so
Yeah,
good.
it starts with family, right?
Yeah, he
Yeah.
it was no, the isn't it health feel health they give, and then we have health insurance here, which really didn't pay much, but it was a very big amount because three people hospitalized isn't a joke.
Yes, it's not a
So
joke, definitely.
yeah, it's very expensive. And I didn't know, Doc, that even the use of the oxygen, they charge you per, was it per
Yeah,
day?
yeah. There are a lot
Akala ko nga
of
baka per
charges.
minute.
Even po yung the isolation, that was the most expensive. Even if
Yes.
you're husband and wife in one room, they charge you individually for
And
isolation
Cricket,
fee.
post-COVID, now, after almost 2 years, right, of your husband having post-COVID effects, how are you managing, like in terms of the resources now? Of course,
Oh, it's a lot better. Yeah.
much better. It's really the hospitalization that drains.
Yes. Although Doc Jimmy, we brought out our oxygen concentrator out again. It's so hot. My husband's having
Yes, yeah.
difficulty now. So when he feels so hot, he turns on the concentrator again.
Yeah.
And thank God for your concentrated.
It's
Yeah, my daughter gave that to us. So it you should not give it away or sell it because you will use it.
Yeah, and it's actually good you mentioned cricket, because not just your family getting closer. It wasn't just that, but God is using this time for, each one to also share more of their resources,
Yes.
right? That again they wouldn't have done if not for this time
Reeves,
of
can I ask your dad a question about current COVID?
right now. Ah, oh,
yes, yeah.
Yeah, I read that am I right? People are still dying from COVID. Is that true?
Yes, yes, yeah. Unfortunately, yeah. So right now, in the Philippines, there is another surge of COVID. Although it's right now, even it is underreported because, as you said, many are now doing the COVID test in your home, the antigen test, no? And therefore, if you're positive, you do not call the DOH and report I'm positive, but you just it's really under. So what we say right now, for example, the report was there are now 25,000 new cases in Metro Manila. You just probably multiply it by four, and that's the real situation.
but
But right now, of course, compared to the time when it was Omicron and Delta, no, there are still people dying, but less. Those who are dying are those with comorbidities and things like. But that so far, the COVID right now is a lot less. What do you call this? We call it either rabid or more. But it is still no. If we are careless, it can still lead to mortalities, to death.
so
So, well, indeed there are, but not as many as during the two waves we had, Omicron and Delta.
But there are still hospitalizations po. Are the
Less and
hospitals
less.
okay?
Interestingly, unlike those times, the two previous surges, no, this time hospitals are not full. Hospitals are not full with COVID. I mean, hospitals can get full with other patients, but
Mm.
the COVID, not in the same level as it was when we had the Omicron and the Delta.
yes,
But we do have it. So we still have to be careful.
yeah,
Cricket,
definitely.
di ba?
Not
Kami
just
rin lang. Kami rin nakamask pa rin pag lumalabas. Nakamask pa rin pag sa bahay. Particularly when we come from the outside.
yes, actually, the key is to not minimize the effect of COVID, because even though for some who just have mild COVID, the post-COVID effect is something that well, we can't determine for everyone it's the same, but there's some who just have mild COVID but have major post-COVID effects. So that's what we're dealing with. That's why we have this long COVID support group for those who are still experiencing post-COVID effects. So if you think that it's just nothing, like, oh, I just went through a flu, we don't know what the effects are. But it's not for us to be afraid in the sense that there's no hope, because of course, God has a solution to everything. We just don't know what exactly for each one. And I cannot answer that for you right now. But I know that having COVID is something that we can manage, right? And of course, post-COVID effects is something that's still being studied, but still also manageable. So we just have to be patiently enduring and persevering with our family members. So for our last question, or last two questions, depends on the time. What are the challenges or barriers in providing care? So what usual challenges do we encounter? I think this was also discussed earlier, but here it says, how can we break these barriers? So I think what this person is asking is, so it depends on the relationship, because like you, Cricket, you have a good relationship with your husband. It's not like you're at war. I mean, of course, you like any relationship, there are a lot of things we argue about, and there will always be some form of conflict. But I think it's how the relationship is. And the one who asked this, I don't want to assume, but if you're talking about barriers in terms of relationship, uh yeah, that's another thing to work on, because if previously you weren't really in a good relationship with that family member, I think you have to restore and reconcile first, because operating in a routine or just doing things for the sake of it doesn't really provide so much support, as if you want to maximize the support we're talking about, that's physical, mental, emotional, spiritual, relational, and so on and so forth, right? So maybe for some, they're thinking, oh, it's okay, I'm already giving this, I'm sending money. I mean, those things are important, but the relationship can't be replaced, right? So, because the question is, how do you break those barriers? And I think it depends on what the relationship is. Dr. Jimmy, what do you think?
Yes, definitely. And I would say I still go by the three words that I've been speaking about: pray, love, and forgive. I
Yes.
think first we pray about it. We open our hearts to the Lord Almighty about what we're feeling, why we're faced with all these barriers. Just um, if you have no one to talk to, also, no, well, that's one. You need somebody to talk to. Secondly, of course, the one to talk to is our Lord God Almighty, and
The
open your heart and
yeah.
just pray. And then when we talk of love, I think it breaks the barriers definitely. And
Yeah.
when take the courage, as Riva was saying, you may not have the same good relationship you had, or you started on the wrong end, but this is the time. And breaking that barrier, even just saying um, to whoever is that member of your family that you love him or her, that you're here ready to take. I think that matters a lot for both sides,
Yeah.
both the patient and the family member who was long COVID and you, and then the forgive. No? Most of these barriers are really, I mean, the way I analyze it, having handled so many patients for the last 50 years of my life as a doctor, talagang forgiveness is the most difficult barrier. No? But again, one has to be aware of it, and the key is take that courage. Remember when Peter asked our Lord Jesus, Lord God, how often do I need to forgive? 7 times? No. And we know it's difficult because even our Lord Jesus Christ said not only 7 times, but 70 times 7. But we do have to forgive. And
Yeah.
well, for me, that
Yeah.
is where barriers stop. And for me, I just like to say I always forgive my wife for whatever. Kasi nga she might be irritated, and if you also get irritated, nothing will happen. One has to always love and forgive.
Yes, indeed. The most forgiving people are the ones who have received God's forgiveness. Because if it's up to us, we will not do it. That's why it's a supernatural act to forgive. Yeah. Have you ever had that moment, Cricket, when you just put up that wall, or like, I just don't want to do this for now?
I think my biggest barrier in the beginning of COVID was finding how we got it and blaming it in other people. So like what Doc Jimmy said, that you have to pass that I have to forgive you, because actually it's my son who had it first. So in the beginning I was blaming him, and we had to break that barrier that they were saying to forgive each other and
Yeah.
help each other.
Yes, yes.
So
And knowing also that, of course, God is the one who oversees everything. So yes, of course, it's natural to feel that way towards your son, but
mhm.
always restoration and reconciliation. If
Yes.
the
And
Lord,
it's a really life-changing event. It's very sad. I look at COVID sometimes. sometimes people think, oh, it's only in your mind, like long COVID. They think, oh, that's nothing. It's like you're imagining. You may be imagining things you're perfectly normal, but
Yeah.
it's like any other disease. It's really real. Some people don't believe that there is long COVID. Even I went through it. And
Yes.
for me, the biggest thing is
True.
because I
Yeah.
was a caregiver, Doc Jimmy, is I
Yes.
suffered a PTSD, post-traumatic stress disorder,
Oh,
from
yes,
the
yes. Yeah.
trauma of taking care of somebody in the hospital is so painful to experience.
Yes, indeed. And
Yes.
losing your father-in-law. So actually,
Wow.
Yes,
And with your father-in-law, and then that facing the death of your,
yeah.
wow, that's the
yes.
most,
So
that's the
I
most,
went through counseling. They were
Yeah.
not the only deaths I had. We had like six
Oh,
that year because another uncle died from COVID, and then my other aunt died too.
yeah.
So I went to counseling. Like somebody asked, I think, a question, what do? You have
Yeah.
to take care of yourself as a caregiver. And what I did was I went through counseling.
Yeah,
I
that makes
had to go through
yes,
it.
yeah,
yes.
that's
No.
I
good.
attended Glorious Hope as well, and
Oh,
then I went
yes.
to
Thank
counseling
you.
because I
Thank
could
you.
not handle it. It was giving me nightmares. I mean, the incident, one after the other. Even the one that was counseling me said, "Wow, that's so heavy. You're losing so many people at the same time." But I had to deal with it, and it was only God that allowed me to deal with it.
Yeah, definitely. And for those who are curious, Glorious Hope is a recovery program that
Yes,
you can check out online. And it's been very helpful. I went through it also because it helps me process all the things I'm
the
going through.
pains. Yes,
Yeah, of course, this journey is not easy and it's not meant to be easy. So it's really having the right people around us and of course the right relationship with God first and foremost because all our other relationships are going to be affected if we're not fully reconciled and restored with God. And that's what I realized for myself because when I had issues with God, I actually used my issues with him to pour it out on other people. And of course it really caused a lot of issues among my other relationships. So I see how we have to go back first to, I mean, really reconciling with God before we can reconcile with others. And the reason why we can support our family in this long COVID journey is because we are not relying on our own strength, but really on God's strength that's always unfailing. So thank you for joining us, Doc Jimmy and Cricket, for your sharing that makes us persevere together. Yeah, I know there are a lot of others also who are going through the same thing, but maybe you didn't uh, experience that yet, or you're experiencing it. Whichever stage you're in, you are welcome to join us in our long COVID support group, especially those who are still going through it up to now. Thank you for your comments. One of the sharings here from Subhashini, truly eye-opening. Yeah. And I want to emphasize, just like what I said in the beginning, as much as we are so focused on our physical health, trying to get well. Like my mom, also three-fourths of her lungs got damaged. But thank God, one-fourth, or one-fourth is already, only one-fourth na lang yung damage. Yeah, so there's one-fourth from three-fourths to one-fourth. Okay, so there's more lung function for her, and of course we had to go through a lot of other things in her journey and we're still going through it, but the good news is one day at a time, every nanometer of progress, God is faithful. So yeah, thank you for the sharing. Also Anna, thanks for the info. We learned a lot. So I just wanted to remind everyone to fill out our evaluation form for those of you who have not filled it out, for those who want to receive certificate also. But yes, we will have a time here of sharing our appreciation. Yeah. So first, here's the evaluation. That's the link or the QR code. Ayan. Ano na tayo? We are in the modern day QR code, but we also have the link here on our chat box. Yeah. I know we have foreign guests, so sorry for the times we're speaking in Filipino, but definitely we're not talking about you. It's just that there's some things that are expressed in our local language, but I think you understand the context. So yeah, for our appreciation, we have for cricket. Thank you for sharing your valuable insights. So we have e appreciation for you, and
Thank you so much.
yes, we have our appreciation not just for you but for your family as well for allowing you to be here with us today. Yeah,
Thank you, Cricket. Thank you so much.
Thank you
such
so
valuable
much too.
insights. And of course, thank you also to Doc Jimmy, Doc Cora's here also, and my mom. I know she's also logging in here. I mean, she's with us, and the rest of our participants who are joining us from different parts of the world. So, yes, I know the context is different for other countries, especially with, other local things that we were not able to mention. I pray you were able to receive some valuable insights that you're excited to also share with others. Yes. So
We'd like to thank also our HFI staff, of course, Michelle, Patricia,
Robbie,
and yes,
yes. Yeah,
Roby, yes, yeah.
the rest of our staff who are not here but or also helping us. So for our yes. Oh, sorry. We have to have a photo pa pala. Let's smile first before
Pero meron ba announcement ba yun? Another long COVID webinar?
Okay, wait. Let's have a picture first. 1, 2, 3, smile. Okay. Yes, and for our long COVID webinar, we have our 7th edition, if I'm not mistaken, Staying Sane Amid Long COVID, Dealing with Post-COVID Mental Health Issues. Okay, so we talked about our mental health as well. So we have Dr. Dido Villasor, who's a resource speaker, a clinical psychologist. This is going to be on June 22, 2023, 2 to 4 p.m. That's Philippine Standard Time. So this is your Zoom registration link. This is free. Everything here is free, thank God. Thanks to HFI for organizing this. So we have everything uploaded in our HFI page. So like and share our Health Features Foundation Incorporated page. And there are a lot of other tips. So there's also Tired of Being Tired, Dealing with Post-COVID Fatigue. That's in July 2023. Care of our doctor, our rehab doctor, Dr. Dunca. Dr. Manalisa Dunca and Mads Valera, or Doc Mads Valera, a post-COVID fatigue patient. Yeah, my mom's also dealing with a lot of um, other kinds of fatigue. So yes, thank you for joining us. I just wanted to remind you about the evaluation, and I'm just reading some of the comments here. Emmy Rose, thank you po. It has been a long time question in my mind if the long hauler is real. It seems it is. We hope to strengthen each other until we're finally free from the effect of long COVID. Thank you for the courage of doing this webinar. Praise God for using your profession to help us understand the situation. Yes, thank you, Emmy Rose and Subashini. Thank you. Appreciate your webinar sharing. And we also have a comment here, anonymous attendee. Agree with a good doctor that for now we are already managing COVID and its resurgence. Yes. So again, do not fear, but be wise and be intentional to think of the risks and care for your family. Think of what would be best for each one. Of course, there will always be that fear of having COVID again, but instead of fearing, let us trust the Lord, as Cricket mentioned, with all our hearts, knowing that He's the God who's in control of everything, and He will really never leave us nor forsake us. And He's with us right now, and that's why we're able to share this, because He's done so much work and He continues to do so much work in our lives, in our families' lives. So let God do the restoration, and let us cooperate with Him as we go through this journey together. So follow us online, healthfeaturesfoundation.com. That's our website, facebook.com, healthfeatures, and then facebook.com, Alaga Ka. That's the flagship program of Health Features, Alay sa Ginhawa at Kalusugan, creating communities of wellness in the marginalized areas that don't have access to primary health care. If you want to support Health Features, we have our donate page there in the website. We also have a Twitter account, Health Features, Instagram. We have YouTube, Health Features, LinkedIn, if you'd like to serve with us here. And I don't think we have TikTok just yet, but it's okay. We have a lot of videos on YouTube to help you, not just in your long COVID journey, but even other health tips. And we'd also like to consult with Doc Jimmy for holistic health consultation, because he doesn't just look at the physical, not just for long COVID, but for any other concern you have, you may also get in touch with us. Yes. Thank you once again for joining us today. May your learning not stay in your laptops and in your phones, but let it be shared with others. We also posted here the long COVID mental health webinar registration link for those who want to sign up for next month. Yes, there you go. All right. Thank you. Once again, we'll see you again next month, God willing, and we continue to pray for our family members and be there for them as God leads us. It's a privilege to serve everyone today here in our webinar. Thank you to all our participants who joined us today. God bless you all.